Hi, I'm Amelia Calderon. I'm from Riverside here in California, and my son Isaac is the patient, so I'm his mother. When Isaac was 12, we went in to see his optometrist, and his vision had changed drastically, and she was surprised. And she started asking questions if he had a head injury or if anything had changed, and no, nothing had changed. So he got a new prescription. So that was in the summer. So in the spring, we were doing another vision assessment, and his vision had changed again. She asked me questions again. She said, "I think something's wrong. His vision's changing very rapidly." His glasses were no longer useful, which is why we had gone back. And this time around, his glasses came in and his prescription had already changed. And so she said, "Something's going on. I think you should talk to your insurance and see if you can see an ophthalmologist." And so we did, but we still couldn't get answers. So finally, a few months later, we discovered it was keratoconus, that's why his vision was changing. Apparently it was a very aggressive form, and he'd gotten to the point where he could no longer read, he was no longer watching TV, he was down most of the time in his bedroom, didn't want to interact with people because it was just, it affected every aspect of his life at that point. It was very concerning not knowing what was wrong, and then seeing different doctors and they didn't know what was wrong, and just seeing how he was shutting down and how it was affecting his life. Really, it was very scary as a mom, and not knowing what to do once we found out it was keratoconus. The doctors we spoke to basically said that they could do cross-linking, which would freeze the eye in place, but that, except for the contact lenses, there wasn't much they could do. And reading online, it sounded really scary how people struggle to get the contact lenses in. He's 14, and just it didn't sound positive, any of the solutions the other doctors were offering. So we discovered Dr. Motwani's method online. We set up an appointment. He looked through the scans and he said it looked like we could still do something. So we brought him in and had the surgery done. That was 4 months ago. And so after the surgery, initially there was pain, and as a mom that was hard. But once he started recovering, he started watching TV again, he started reading again, he started playing with his siblings, which he no longer was doing. He was just isolating and just going back to the way he used to be. And so it was, for us, it's been very nice to see how his joy came back, and he's just able to see. And at this point, he's got one eye that's stronger than the other, but they're both improving. So we're hopeful that it's just going to continue to get better. I would recommend anyone else who has keratoconus to at least consider talking to Dr. Motwani to see what he recommends, because what he's doing here is very different. He offers a procedure that can actually improve your vision, which is my understanding other doctors don't. I definitely would recommend it for anyone with keratoconus to at least consider talking to the doctor.